Mindfulness Lounge. Everybody comfy and ready to go? I hope you found our program, How to Find the Right Mental Health Counselor, valuable. Now you can engage with the panelists and ask those questions you always wanted to ask, as well as new ones from today's program. Our panelists are ready for your questions. They are Pilar Tamburrino, MS, LMHC, Assistant Director, Faculty and Staff Assistance Program, Miller School of Medicine, University of Miami. Marlyne, DeLima, MS, LMHC, Founder and CEO, Changing Perspectives. Kathryn, Coppola, Esquire, Executive Director, Nami, Miami-Dade. And Sandra L. Brown, MA, CEO of the Institute for Relational Harm Reduction and Public Pathology Education. Let me remind attendees to click on the Q&A button and be sure to address your question to the panelist intended. While we are waiting for your questions, why don't, Zuri, are you, can we go ahead and ask each of the panelists to give a quick tip while you're getting the questions submitted?
Absolutely.
Okay, so panelists, would each of you just give a quick tip on matching with the best counselor? Pilar, why don't you start us off and then we'll proceed in the same order as before. That's
one tip?
Oh,
just one tip?
One tip. We'll probably call on you again for another one.
Yeah, I have more than one tip.
Okay, good. So Pilar, Marlyne, Kathy, then Sandra. First tip. Okay.
First tip, be open-minded and curious. It's a new experience if you've never been in therapy before, so you have to keep an open mind.
That's on point, Pilar. And also, I mean, it's hard to narrow it down to just one tip, but one of the things that's important is to be seeing the right person for whatever it is that your issue is. So if you are looking for someone who is going to help you with marriage issues, marital issues, then you should have a therapist who's experienced in that. If you're looking for therapy for your child, you know, what is the issue? What is it that you want? Be clear on that, and then, or have an idea at least of what you're looking for, and make sure that the person that you're connecting with is experienced. And while you're looking at that, make sure that you check their credentials also. Make sure that they are, in fact, what you think they are. If they're licensed, you know, and the more credentials, the more it means that they're specialized in their field and that they've had the right training. There's so much out there, guys. And so you don't want to just pick anyone that calls themselves a counselor or pick anyone that says they're a coach these days. You know, I can't stress that enough. And even with the credentials, it doesn't mean that you are going to be a good fit. Earlier, Pilar talked about, you know, the chemistry having to be right. Just because someone has the credentials doesn't mean that they're going to be someone that you're comfortable with. And so if you're not comfortable with them because maybe he or she reminds you of a family member that you had issue with, or it's okay to say, for some reason, I don't feel comfortable with this person, and to just bow out. So, and find someone else. So those are some things. And since I'm limited and Kyle said quick, that's it, I'm gonna stop.
Yes, and Kathy, a quick Nami tip.
Yes, so check mark Pilar, check mark Marlyne, and likely check mark all the other ones we're going to hear from. So those have to be part of it, but also attending a support group. So if you're a family member, if you're a peer, talk to other people who have gone to a particular doctor you may know, or someone that you tell the people in the support group, hey, I'm looking for someone like this, someone who Pilar and I have talked about, who takes me for a spin around the campus while we're having our therapy, if that works for you. So talk to other people about it too, and talking to people who are willing to share everything with you.
Thank you, Kathy. Sandra?
Well, I think everybody's hit on some good things. And I would reiterate the need to align yourself with picking the kind of therapist that you are, going into counseling for those issues. And again, in our specialization, that's where failed treatment has happened quite a bit, that survivors don't know they have trauma, go to a much more generalized counselor, so never get trauma treatment, and continue to be symptomatic. So I'm with Marlyne on that about hooking up with the kind of therapist that is geared to what you're seeking counseling for. I know this has been a big issue, again, in our little niche field, is a lot of survivors don't understand the difference between counseling and coaching. There are, that's a whole other whole workshop, because there are times when coaching does work and is preferable, and times that you absolutely need counseling. So I think survivors would benefit from reading up on the differences between coaching and counseling to know what level of care you possibly need for what you're going through.
Thank you, ladies. So we're going to get into the questions. We have a couple, but before we start anything out, let's make it basic. So Pilar, why don't we start off with you? How do I know if I need a mental health counselor? Let's start with that.
How do I know? Well, if you're experiencing any kinds of symptoms that are interfering with your ability to function, your day-to-day, like you're having problems sleeping, your appetite has changed from one day to another, very general symptoms that sometimes we don't recognize that we're neglecting these signs or red flags. So if you're experiencing things that are differently, you see your mood is changing, your appetite, your sleep, your relationships with other people, then maybe that's a moment to pause and to kind of assess, well, maybe I am experiencing some kind of anxiety or depression, or maybe something else is going on, to reflect whether there's family history. So there's different ways. For example, in our website, we include an anonymous assessment, an online assessment, and it kind of asks you very general questions, but it kind of categorizes whether what you're experiencing is more towards anxiety or depression or bipolar disorder. And then at the end of the assessment, again, it's free, it's confidential. At the end of the anonymous assessment, then it tells you, it's based on the answers to your questions. It seems like you're experiencing some mild or moderate anxiety. Maybe you should talk to a counselor. So those are some ways, but I think sometimes we kind of push things down or pretend or kind of neglect those red flags that are loud and clear. So it's very important to see, how am I different? How's my mood different? How are my relationships changing? Again, these are symptoms and signs that are there. And when they start interfering with your ability, your energy level, your desire to do things, then maybe that's the time to check in with someone.
Okay, thank you. And in line with that, I'm opening this up to anyone on the panel, not just Pilar, but there is a question that was received from Brianna. So she wants to know, how do you pick the right therapist when you just don't know what exactly the mental health problem might be, or the diagnosis is not quite accurate? How do you know which type of therapist to really pick that could help your loved one?
I don't mind answering that question. I think it's you start first with the general, like we said. If and what I'm understanding from the question, it's how do I know if I don't know what I really need, right? Is that what the person's asking? How do I even choose? And so with that, I would look for a few things. First of all, gender. Let's start with a simple thing. A person might ask themselves, am I more comfortable with a female or a male? If your injuries were from a male or female, you might want the opposite of that person as your therapist. You might feel more comfortable. There are good therapists, good male therapists and female therapists, obviously. So sometimes it's just a question of yourself and what you're comfortable with. So you might start with that simple question. Then you go to, how can I know that the person I'm going to is in fact a professional, is in fact someone who knows what they're doing, basically. And this is where, searching for them makes a difference. So you can go, if you're having to go through your insurance, you could find out through a list of providers, through your insurance, who's under that.
To fine tune it just a little bit, how can you, if you don't really have a diagnosis to
Right.
dictate exactly what type of problem the mental health disorder might be, what type of therapist, what type of counselor should you even be looking towards? What direction should you be following?
General counselor, I would say, a psychologist or a licensed mental health counselor. I mean, if you go to a counselor and during the course of the assessment or the first few sessions, they recognize that what your symptoms or signs or what your diagnosis is not in their level of expertise, then as an appropriate professional, you would refer that client or patient to someone whose expertise is that. So I would start with a general counselor. Most general counselors have a little bit of experience in a lot of different things. But if it's something very specific, like something with the trauma, like for Sandra's cases, then at that point, as a professional, you would refer to someone and have the client either go back to the health plan and ask for someone that has experience in a specific area, or as a good therapist, you would know other people in the community and you would refer them to someone else that you know.
Thank you. And to follow up with that, because I know it ties in very well with this other question, we talked about it before, just matching with the right counselor also deals a lot with screening practitioners, those interviewing skills. So what's a good rule of thumb when it comes to screening and interviewing your practitioners, of those that you're starting out and you're learning to find out if they are the right match? What should you keep in mind when you're starting out?
I would start off by saying it's COVID-19 years, okay? So when you mention what do we keep in our mind, really hard for anyone to keep in their mind a whole lot that's going on, especially if you think you're already having some mental health issues. So write it down, write it down, write it down. Okay, so kind of like I'm sorry to say, some of us have had some serious issues in our past. When we write it down for the medical doctor, you go in and you say, this is what's been happening for the last 3 weeks, and why not? You do the same thing. These for you take care of your mental health just as if you would your physical health. So write it down, keep a journal if you must, if you can, if you have the energy to do so.
Good advice. Pilar,
That's wonderful advice.
Yeah. What about you, Marlyne or Sandra? Did you have any rule of thumb?
Yeah, I would second that also, because you forget by the time you speak to the professional, what happened, how many nights did you stay up, and what happened on this third day or fourth day, and it helps you to recognize what we call your triggers, what your triggers are, what's going on, what has caused you right before feeling that anxious feeling, what happened before that. So if you keep a record of that, I love that you said that. That is great advice. But also when you're talking with the therapist, not to be afraid to ask them if they've had experience with that issue. There's nothing wrong with asking them that. And if that's their specialty, don't be afraid to use words like that, because they might be familiar in the general sense, but maybe you need them to be more familiar with it and to specialize in that particular issue that you need help with. Because if they're not well versed in it, then you're not getting the best help.
Going, a question for Sandra, kind of tying it along too. How can you find the right trauma care when you're interviewing? These skill tips, what should you have in the beginning? Tips to have in mind when you're trying to find the right care for trauma specifically.
Well, to piggyback on what Marlyne just said, is sometimes you go to someone's page or listing on Psychology Today, and they list 50 things they treat. Yes, it's good to be, trained in a lot of different stuff, but specifically in trauma, because trauma is sort of a specialization, is to find out if they in fact have had additional training in trauma or trauma certification. If you have a sense for maybe the kinds of work you want to do or not want to do, somatic processing, maybe you're looking for EMDR, is to, ask very specifically and ask what their treatment approach is. Trauma has, like I mentioned before, is ever changing, and lots of new frontiers, it feels like, in the last 15 years. And so when I hear one of the survivors say they only want to do talk therapy, that tells me they probably haven't updated their skills in 10 years, because trauma treatment is not very much about talk therapy anymore. It's much more somatic and body-based. So, find out the approaches, and if that feels like a good fit.
There is one question that we received from a registrant and attendee about, from Amy, about the after being divorced from a psychopath, what advice would you give to help heal and disconnect from the emotional damage that may have been caused and move on towards being able to date again? What advice would you give, Sandra?
Well, again, going back to our trauma studies, is that 75% of them have trauma. So if we're going with the statistics, she needs to get checked, because trauma sometimes worsens over time. A lot of survivors do things that they think are helpful for themselves that is actually contraindicated and is increasing their trauma. But we get that all the time, where the survivors say, I just want to move on. Well, there isn't a person alive, that has trauma that doesn't just want to move on. But unfortunately, that begins to be part of what keeps someone stuck in the inability to move on. So get assessed and treated.
Okay. Yes, thank you, Sandra.
Is there a directory of all of the professionals, mental health care professionals that you all have trained? If it's over 1,000 now, that's
Yes.
great.
Yeah, not yet, because it's 2 parts. So those 1,200 have taken the first part, and they've got to take the treatment portion of that, which we are hoping is going to be right after the holidays. Once they have completed that, passed the testing, and go through the certification process, it will be listed on the website survivortreatment.com. Survivors can probably, after the first of the year, go and find people that are trained, trauma certified, master's degree or higher, and trained in our model care for this particular thing.
And in the meantime, your program is available online for survivors.
We have a 1-year trauma reduction program, online program, that they can find at saferelationshipsmagazine.com. But yes, they can do that. it's a good adjunct to working with a trauma therapist. We get a lot of trauma counselors who refer them in, but it is not in lieu of trauma treatment.
One quick question to you, Kathy, for Nami. Just very briefly, are there some mental health conditions that are not appropriate for Nami support groups?
So we invite everyone to come to our support groups, but we are looking for people who are working on their recovery. So someone who's in the midst of psychosis is not going to be able to get anything out of a support group, is not going to be able to listen and participate. Even if they've got their videos off. So we want to be clear that we provide a safe space for everyone, so that someone who's in the midst of psychosis, and then therefore we are required, if we have the information, to make notice of the police to Baker Act them as well. So that has only happened once to someone we know well, and it worked out well. Let's just put it that way. So otherwise, people who have schizophrenia, bipolar, anxiety, and depression, some of those issues are going to be the same. So we think to come. Now, of course, Sandra brings up the difference between a sociopath and whatnot. So I can't address those kind of personality disorders. But otherwise, yes, everyone is welcome.
Okay, thank you, Kathy. And so I think this can go towards Marlyne, but anyone else is open to discuss this too. Is the cost or price of therapy indicative of the quality or value that you're going to receive in treatment? And if, for example, if you don't have health insurance, what options do I have? So kind of combine that question.
So I wouldn't say that it's absolutely indicative of that, right? Because you could be paying someone a whole lot of money, and for whatever reason that therapy doesn't work best, is not best for you, best suited for you. So for all of the reasons that we mentioned today, but typically in relation to the experience that the therapists have had. So, look at what Kathryn shared with us today about Nami and free services. I wouldn't want anyone to think, oh, it's free, so therefore it can't be helpful. It can. And so keeping in mind all of the things that we said, I think it just depends on any number of needs that the individual has, and go from there. And just not being afraid also to ask a therapist if you can't afford their rate, not being afraid to ask them to reduce the rate. And some are willing to do that.
Marlyne, I understand that Medicaid also covers mental health. Have you had any experience with that? So
I personally am not on any of that, but yeah, that's a question that everyone should ask. If you are, there's some of the preliminary when we talked about in our earlier sessions, what to ask, what to look for. Those are one of the, do you accept insurance, to your insurance provider? And also, do they accept Medicaid and Medicare? Personally, I don't have experience with that, but that is something that I would ask.
Most community mental health centers will accept Medicaid. So that shouldn't be a barrier for you to get therapy.
Correct.
And I'll also say, not just, this just happens to be one community organization that I know, so there could be some others out there. But pre-pandemic was the last time I checked on CHI, was $5 a visit.
Right.
So some other community health organizations are maybe 50 or more. So you want to check around.
Right.
And what
In
is
South
CHI?
Florida, we have CHI is wonderful, New Horizons. We have Douglas Gardens on the beach. I mean, there are a lot. And for people that don't have insurance, it's on a sliding scale. It's based on your income. If you have Medicaid, they accept Medicaid. So there are services out there that are affordable to anyone from any socioeconomic background.
And what you can also look at is thrivingmind.org. And that's the managing entity for the Keys in Miami-Dade County, but there is a managing entity for every county, and they cover the safety net. So they have a great manual on their website in Creole, Spanish, and English. And they also have a helpline you can call, or you can call us and we'll connect you to some others. So that's what we do. We do resources.
Is Thriving Mind just Florida based, or is it nationwide?
Florida, no, Thriving Mind is only Miami-Dade in the Keys, but it's what's called the managing entity because we don't have a Department of Mental Health in Florida. So it's money that comes down from the state through DCF to the managing entities, and they fund the safety net for people who don't have any other care. So they do addiction as well as mental health services.
Right.
They fund it. They don't do them themselves.
Kathy,
So
what is CHI? What does CHI stand for?
Community health. Oh, it doesn't even, it's not even, the acronym is not appropriate.
It's down south. It's down south. It's
Okay.
a community mental health center. Everybody knows it by CHI, but it's down south by Homestead.
Okay.
It is, and they do have, or they did have one in South Miami. They had, I think they're revamping the one in the Grove. They are starting a children's mental health hospital. They broke ground for that as well.
Okay. So I know we're getting close to the time. I just have 2 more questions to ask, if that's okay. One is directing to Marlyne, so we'll keep it very brief if we can. Marlyne, about how can couples find the right match for counseling that can fit the needs of both individuals? If you can touch base on it briefly.
So again, in searching for a counselor, as you're searching for couples counseling, you want to make sure that can everyone hear me okay, first of all?
Yes.
Okay. You want to make sure that the counselor is well-versed in couples counseling. One of the key things, I think, complaints across the board when it's not a good match is that the counselor was not impartial. So if in that experience you feel like they're siding more with one than the other, and sometimes it's a little biased on the part of the person whose issues might be brought to the forefront and they're just not willing to work through, that's what's happening, where you don't feel like the counselor is able to be impartial, that's a big no-no. They should be able to do that. So that's one thing to look for, as well as I said, just initially making sure that you ask about their experience, how long they work with couples, and so forth. That's putting it briefly.
Yes, thank you, Marlyne. I think that's perfect. So to wrap it all up in 1 minute, if each of you could offer one piece of advice to our attendees regarding mental health, what would it be? So let's start off with Pilar.
Piece of advice for mental health.
Yes.
I think mental health should be prioritized. I don't think we talk about it enough. I don't think we understand it enough. I think the most important thing is just to have open conversations about that, to be able to talk to your friends, to your family, to not have it be something that's a stigma, something that this is like talking about your family history about high blood pressure or diabetes, so having those conversations. And I think as clinicians, as people in organizations that want to promote mental health, and I'm sorry, I'm trying to keep it as short as possible, we model that, right? So we have to also be very open about, yes, this affects all of us, including the clinicians. Like, these are topics that it's not just that I'm the clinician and you're the patient. It's like, I've been in your chair, you could have been in my chair. We have to talk about it openly like that. And I think that's what's going to allow people to say, hey, it's okay. And once we say it's okay, hey, it's going to be okay. People are going to look for therapists. People are going to, and I think this pandemic has shown us that now people are actually talking about it, searching. We've had a rise in our clients' referrals and people wanting to search out and talk about what they're going through, and that it's okay to talk to someone.
I would say the same in terms of being very real about the need for help. I think if we look at the world of the internet, people are desperately searching for more of feeling like somebody else can relate to me. So why not be more vulnerable? Why not? I think as we become vulnerable, we allow others to be more vulnerable, right? And that includes saying, you know what, I don't feel like myself. I feel a little out of sorts. I think I could use more help. And it should not be any different than the analogy that I mentioned earlier, which is if you had to go to the gym to work out and you saw the importance, everyone at the gym is not at the same level. Some are trying to lose 10 pounds, some are trying to maintain their weight, some are trying to build muscle, but they're all at the gym. When you seek therapy, you are at your own stage, you are in your own pace.
Mhm. And then Kathy, what advice would you give?
My advice would be to listen to Pilar and Marlyne, and because they have just done an advertisement for Nami, why you need to come and be with others like you. Go to the clinician, right? But come to Nami and we talk about our stories. People are here, we're open. That's who we are, that's why we're here. So, in a nutshell.
Thank you. And then Sandra, to wrap it all up, what would you say?
Especially in trauma, that it's so hard, the experience that they're having. And I always like to remind my clients that they will not always feel the way that they currently feel. And I share my story from 30 years ago when I had PTSD and didn't get out of bed for 2 years, to, you know, going to grad school and being able to do whatever I've done. So I think it's really hard to sometimes think beyond or hope beyond what you are currently experiencing. And but they will, you know, with treatment, they will not always feel the way they currently feel right now.
Thank you, ladies, all for your wonderful advice. This is all incredibly important discussion to have. So we're going to toss it over to Kyle to wrap this up.
Okay, wrapping up our lounge time. Those, yeah, great questions and great information. So don't forget, you can review today's program, how to find the right mental health counselor, and the lounge Q&A soon on our YouTube channel. Please make sure to take the survey that you will receive via email. That's attendees, not panelists. So also, we hope that you will join us on January 22nd for Women Authors Across Cultures. Where are we going? And don't forget to donate on November 18th, Give Miami-Dade. We appreciate your contribution. So everyone, take care and be safe, and have a great rest of your weekend. Thanks for joining.